Good afternoon, ladies and gentlemen. Welcome to the new edition of Gleneagles KL Live at Lunch. Today, we are very happy to have Dr. Warren Low, Consultant Urology from Gleneagles Kuala Lumpur, to have a sharing about the topic bloody urine. Is it cancer stones or kidney stones or kidney cancer? So it is a very common topic among men and women. So today we're happy to have Dr. Warren to share his knowledge and also some treatments, etc., with all of us here. So, Dr. Warren, are you ready?
Yes, I am. Thanks,
Okay, I will pass over to Dr. Warren. Thank you.
Many patients can present with blood in the urine. So commonly, we encounter patients, for example, bladder cancer, kidney cancer, prostate cancer, they all can have blood in the urine. Not forgetting the fact that urinary stones are also one of the reasons why people get blood in the urine. And there are also other things like urinary tract infection. Women know it best because sometimes they can get higher incidence of urinary tract infection. So for those patients, with when they pass urine, blood in the urine together with infection is nothing uncommon. Encounter when it comes to stones in the kidney, are they the same as the gallbladder stones? I would say that they are quite different because most of the time, when you talk about the kidney stones, there are many types. For example, calcium, uric acid, strobite, cysteine, and of course others. Now, from the slides here, you can see that there are so many types of stones here. Now, can we actually pinpoint what sort of stones are they? Yeah, we can to a certain extent, but not all the time that we are accurate. Because most of the time, the stones can be a blend of many, many things. Like for example, you can have uric acid stones, calcium stones blend together, and you could also be having a strobite stones, which essentially is a infective stones. Now, how the stones form? Stones form because of the urine become too saturated with the salts that can form stones, or because of the fact that the urine is lacking of some form of inhibitors, for example, citric. Citric is such an inhibitor because it normally binds to the calcium and is often involved in forming stones. Now, I would say about 80%. It is surprised to find out that oxalate is actually a naturally occurring substance from the fruits because it can be found like fruits, vegetables, nuts, or even chocolates. Some dietary factors, for example, those patients who consume high vitamin D, intestinal bypass surgery, who have had those because of some cancer or even some metabolic disorders, all these things can cause the disturb the concentrations of the calcium oxalate in the urine and leads to kidney stones formation. So calcium stone can also occur in the form of calcium phosphate and also can occur in the form of calcium oxalate. As I mentioned to you earlier on, the common one is actually calcium oxalate, but you can get calcium phosphate stone, and most of them are actually found in those patients with a metabolic disorder, such as renal tubular acidosis. Now, the strobite stones are basically infective stones. Now, for those patients who actually have recurrent urinary tract infection, strobite stones can happen, okay? And these stones can grow pretty quickly, and often they become very large, and that is what we call stack point calculi. Now, a lot of people do encounter gouty arthritis. You know that gouty arthritis is because of the uric acid. So the uric acid also can give you stones in the kidney. Now, when you have a high concentration of uric acid, most of the time, those patients would like to consume things like, for example, red meat, seafood. Stones can form in those people who don't drink enough water, or those patients who are actually dehydrated. And of course, a lot of people do not know that uric acid is basically come from a high protein diet, especially red meat. Those who like to consume seafood, nutty stuff, or even the beans, most of them will end up with high uric acid, okay, and ultimately form stones. Now, cystic stones is usually a hereditary disorder. So these type of patients will have recurrent stone formation and is very, very difficult to treat. And a lot of times we need to send this type of stones for stone analysis in order to identify that these patients are actually suffering from cystinuria or cystic stones. Other risk factors are, for example, family history, diet, dehydration, hypoparathyroidism. Those patients who are long-termly taking the loop diuretics or even something like, for example, HIV medication, they are all potential medications that can form stones. Those patients with a chronic urinary tract infection, like what I mentioned just Now, the screw-white stones can also happen. Those patients would like to take high salt diet, of course, watch out for that. Those patients who are obese, we found out that they actually have a higher tendency to have kidney stones. Now, kidney stones is nothing but hard deposits in the kidney. It consists of mineral and also the acid salts. So when the urine is concentrated, the minerals get crystallized, stick together, and ultimately form stones. So you can see from the slides here that the stones are actually originated from the kidney. So you can see that once a stone is formed, it can either decide to stay put in the kidney system, or it can decide to actually be thrown off. Following the urine, we propel down to the ureter and get stuck in the ureter. And this is the time whereby the patient starts to get problem with groin pain and probably bloody urine, because when the stones travel down, it actually causes a lot of friction along the way. Now, as I mentioned to you, the stone, when it travel down to the ureteric stones, if the patient get lucky, the stone get thrown off from the ureter, it actually will drop down into the bladder. And sometimes it just stay put inside the bladder and ultimately become bigger. And of course, there are also stones that can actually pass through the urethra. So you can see from here, this is basically the natural progression of the stone. It can urethra, causing a lot of symptoms like pain, fever. Why fever? Because sometimes the urine gets stagnated inside the kidney, and then it gets potentially infected and form infected stones, and also infection urine in the kidney. So that will lead to fever and also loin pain, and of course, the patient may encounter burning sensation as well. So when the stone is actually stuck in the bladder, the patient can encounter bloody urine and also pain, and of course, difficulty in passing urine. So the common symptoms are basically pain, difficulty in passing urine, blood in the urine, cloudy color urine, especially when it's actually infected. Patient can also present to us passing sandy particles, burning sensation while passing urine, and of course, those who actually have severe infective stones, or those patients who have stones which are actually stuck at the ureter with the dirty urine stuck down there, they can have fever, chills, rigors. Okay. So now there are some patients who actually encounter stones problem, especially with the stone that's stuck in the ureter. What happens is that they may encounter pain, but after a while, with many days of painkiller, the stone pain would have disappeared. And a lot of patients will feel that okay, the stone could have passed. But what they do not realize is that sometimes the stone is still very much inside too, but the body get used to the pain, and because of the painkiller, the patient will start to have no symptom. So ultimately, what happens is that the patient may end up with a non-functioning kidney, which is identified from the routine medical checkup, many years later. So what are the tests we can do for the patient? Number one, kidney function test essentially is a blood test, urine test, and of course you have imaging such as X-ray, ultrasound, and CT scan. Is X-ray the best thing to have? Well, the answer is no, because as I mentioned to you earlier on, patient can have uric acid stone. So acidic stones, you can't possibly see from X-ray. Cystic stone, you can't possibly see from X-ray. So X-ray is not the best diagnostic modality. Now, what about ultrasound? Ultrasound is good in the sense that it is, of course, no radiative problem. But the problem is that ultrasound is good at picking up sizable stones. Okay, very, very tiny, fine stones you can actually visit from the ultrasound. And the other problem is the ultrasound is that ultrasound is meant to look at bigger organ, for example, kidney, bladder, liver, gallbladder. But when it comes to tubular structure, as I mentioned to you, the stone can get stuck in the ureter. Those stones will not be picked up from the ultrasound unless it starts to show obstruction. When the kidney get bloated up, then of course the ultrasound can indirectly pick up a big dilated kidney. That could be suggestive of an obstruction down there in the ureter. Now, the gold standard is ultimately the CT scan. For those patients who have recurrent stone formation, we always will advise them to go for stone analysis. And even though we can't promise that this time, even though it can be a uric acid stone, the next time can still be an alkaline stone, then the following time could be an infective stone. So it's very difficult to actually pinpoint, whether we can sort of like help to prevent the stone formation, because that we take various type of diet. Unlike children, because my youngest patient is only about 2 years old, so when their diet is more or less more controlled, we can certainly stand the stones for stone analysis in order to prevent them from getting recurrent stone formation. So as you can see from here, this is an X-ray. X-ray shows up stones in the bladder, okay, and the other one beside it is actually an ultrasound. Now, looking at this is basically nothing but a CT scan. So you can see the stone in the bladder and also stone in the kidney as well. Now, In terms of treatment, what do we do? For some patients who have very tiny, small stones, for example, 1 or 2 millimeters sitting in the kidney, we would say probably you don't really need to do anything. Drink a lot of water because from the literature, it actually shows that 97% of stones, which is 3 millimeters or less, will pass on its own. 97 is not 100%. So sometimes you can have very small stones that get stuck in the ureter. Now, what we advise them to do is that, okay, drink more water. But these type of stones usually do not give a lot of symptoms to the patient. Sometimes the patient may feel it, especially when they get dehydrated. For example, overnight dehydration, the next day when they kind of like wake up because of the overnight not drinking water, they can get a bit of pain. And occasionally, when they exert themselves, they exercise, so they get dehydrated. So you can see that the kidney is actually encroaching onto that small little stone, and sometimes can give you a bit of pain and of course bloody urine. So when it comes to slightly bigger stones, what we say that, okay, now we probably can do something for you. But there are also some patients who ask me, okay, small stones, do I really do need to do anything? What about medication? Medication, will it help to sort of like disperse off the stones, or will it help to sort of like dissolve the stones? Well, I would say that if the stone is purely because of the uric acid, then you can certainly give some medication that can treat the uric acid, bring down the uric acid. Sometimes the stones will disappear, and this is what we call medical dissolution therapy. Now, what about very, very tiny stones? As I mentioned to you, 97% will come out on its own, but that is not 100%. Because when the stone gets stuck down there in the ureter, what happens is that you can certainly give some medication to actually dilate the ureter a little bit. And the one that we commonly use is actually the alpha blocker, which is essentially a prostate medication. So you know that for those men with a prostate occlusion problem, when you take the prostate medication, it opens up the prostate. Likewise, when the stone gets stuck in the ureter, sometimes what we do is that we open up the ureter with the medication, and the stones can be propelled down to the bladder. And once it's in the bladder, it's actually quite easy for the stones to actually come out. Now, when the stone is a little bit bigger now, we can do something, because just now we mentioned about very fine stone, you don't have to do anything. But what about bigger stones? Bigger stones, you can actually suggest the patient to go for ESWL, which is an extracorporeal shockwave lithotripsy. Why is it so? It's because when the stone is too fine, you know that when we do the ESWL, you can see from the picture here, the patient is lying on the couch. Okay, so you will have the machine which is blasting the stones from behind. So when the patient is lying down, you know that we breathe, we human breathe. And on top of the kidney is nothing but your lung. So when you breathe up and down, very, very fine, tiny stones, sometimes the you know that the machine that's supposed to blast the stones will instead be blasting the kidney rather than the stone. So very small stones, we would advise not to go for ESWL. So I think the barest minimum is probably 5 millimeter onwards. Then you can suggest to them that, okay, maybe ESWL or extracorporeal shockwave lithotripsy is the way to go. So that is for 5 millimeter onwards. But what about larger stones? Well, I would say that maybe the cutoff point is up to about 20 millimeter, because anything bigger than that, what will happen is that when the stones have gotten so big, when you blast it, all the small little fragments will come down and after that block the ureter. And this is the time whereby the patient will present to you with very, very severe pain. Now, when it comes to bigger stones in the kidney, what do? We have something called PCNL. I think those patients, those staff nurses who work in the operating theater, they are not, not uncommonly encountering this type of machine. So you can see here, it looks a little bit gigantic, right? So this usually is meant for those patients who have stone, sizable stone, which is 2 centimeters and above. So what we do is that we will puncture the kidney directly with this thing. And after that, the ultrasound or the laser can be deployed to actually fragment the stones in the kidney. 2 centimeters and above. So we can have 5 centimeter stones, 6 centimeter stones stuck in the kidney, appear in the form of a stag horn, like a deer horn. So this type of stones, we can actually use this method. Now, for very, very small stones in the kidney, bigger than maybe about 5 millimeter or so, had a few times of extracorporeal shockwave lithotripsy, never seems to fragment even a bit, not even a crack. So those type of patients, we actually can propose the RIRS or FIRS. So you can see from here. So what we do is that we actually put the patient under general anesthesia, and then after that, advance the little small scopes inside there through the ureter into the bladder up to the ureter, and after that, eventually entering to the kidney. So you can see from here. So this is the machine that we use, or the equipment that we use to actually get the stone out. So we use the laser, and after that, what happens is that when the stone is fragmented, we actually can use a basket to actually remove the stone. So what I'm going to show you here is the basket. So I'm not sure whether you can actually see properly. So when we open up the basket, will actually be opened up to capture the stone. Okay, so we control it from this hand. All right, so once the stone is captured, we remove the stone. Now, what about for those patients who actually have a stone that is stuck in the urethra? So you can see that I'm actually using another equipment here. So this type of stone, same thing again, we actually put the instrument through from the urethra or the penis or even the urethra in the penis. And then after that, advance into the bladder and ultimately enter into the urethra. And we use the laser to fragment the stone. So this is what we commonly do. Now, for those patients who we actually had a big bladder stones, now you can see, sorry about that. So you can see that this is a PCNL. So the slides is showing something that I've just explained. So the machine or the equipment will actually go through a kidney. So it's a very small puncture hole, probably about 1 centimeter or so. Then we use the ultrasound or the laser to fragment the stones. So this is PCNL. Now, for those patients who have a smaller stones in the kidney, then we can use the RIRS or FRLRS. So I also have shown you this just now. And for those patients who have a stone that gets stuck in the ureter, we often fragment them with the laser, and after that we use a basket to capture the stones and pour out the stones. Now, for those stones which are actually stuck in the bladder, we can either use an endoscopic method, whereby we put a camera in, see the stone and fragment it with a laser or with an ultrasound, or for very sizable stones, we have to do an open method. That means to say that we actually make a big incision to remove the stones. You can see from the picture here. So yes, we do have stones which are very, very big, and especially those who have a big prostate, because you know why? For those patients who end up with a big prostate, most of the time they are not able to empty the bladder. So the urine stagnated in there. Urine is nothing but salt and mineral, as you know. So eventually it will crystallize and form stones. And that's how the stone is formed. And that's how some of the patients with a big prostate will end up with a big bladder stone as well. Now, is there anything that we can do to modify our lifestyle to prevent the stone from coming back over and over again? Because I always mention to the patient, once you have stones, very highly likely that you're going to end up with recurrent stone formation. So there are a couple of things that you can do for yourself. For example, drink more water, avoid certain stone-promoting food. For example, nutty stuff, soil, sweet potato, tea, or chocolate. Choose diet which are very low in animal protein, especially the red meat. And then, of course, there are some medication that we can use to expel the stone. There are also some medication that we can use to dissolve the stone, for example, the uric acid stones. Now, I think this is so much about the kidney stones, and let's proceed to talk about the next topic, which is kidney cancer.
Thank you, Dr. Warren, for sharing on kidney stone. Next, we move on to kidney cancer. So, in the meantime, feel free to drop us any message, any question on the chat box. Then we will answer you in a short while.
All right, so thanks, Alan. So coming to the kidney cancer. Well, a lot of people may ask me, okay, how common is the kidney cancer? I think our Malaysian figure is probably 2 in about 100,000, and that was the last figure that I got. So kidney cancer is actually the 9th most common occurring cancer in men, and the 14th most common occurring cancer in women. There are about 400,000 new cases identified in 2018, and most of the time, if you were to ask me, what is the commonest symptoms that the patient may encounter or may experience when they have kidney cancer? Well, the commonest symptoms of kidney cancer is no symptom at all. Some patients may end up with some microscopic blood in the urine identified from the urine test by the GP. Some patients may even complain of frank blood or blood clot or even light pink like blood stained urine. So they are all common presentations of kidney cancer. Well, I would say that back pain is not the commonest. Most of the time, if the patient will end up with back pain, usually they are quite severe. And of course, we do have patients that have kidney cancer that have spread to other organs. For example, if they are, cancer that spread to the lung from the kidney, then the patient may end up with difficulty in breathing. And of course, those cancers that have gone to the bone, the patient may end up with bone pain. Well, there's actually no age limit because I have patients who are very young, for example, in their teens having kidney cancer. Why? Because it can be hereditary, okay? And there are also elderly men or women who actually have kidney cancer. So nobody is spared. There's no age limit for that. So what are the risk factors? we always blame smoking. Yes, smokers, watch out. And of course, as I mentioned to you, there are some patients who are genetically linked to have this kidney cancer. They will actually tend to get kidney cancer fairly early in their life. There are also patients who present to us with kidney cysts. Now, mind you, not all cysts are actually benign. Some of the cysts are actually cancerous because cyst itself can be divided into four types of cysts. Now, type 3 and type 4 actually stands about 60 to even 90% risk of turning into cancer. So watch out for kidney cysts. We also have found that those patients who are a little bit more obese are having a higher tendency to have kidney cancer. Those patients who consume painkiller, who works in a chemical factory or who stay nearby a chemical factory may actually expose themselves to higher risk of getting kidney cancer. Elderly people, those patients with hypertension, those patients who are on dialysis for kidney failure, they are actually strongly associated with kidney cancer. Now, of course, not all mass or tumor found in the kidney are kidney cancer. Some of them are actually benign tumor, for example, angiomyolipoma. What is that? It's basically three elements in one tumor. Angio means blood vessels, myo means muscle, and lipoma means fat. So you can have a blend of all these things together, forming a mass, but they are not cancer. Okay. We can also have cancer, like for example, uncommon cancer, for example, the lymphoma, Wilms tumor, or even cancer from elsewhere that had gone to the kidney and sort of like manifest like as if they're having a kidney cancer, but they are not. They're basically spread from other cancers. So when it comes to the kidney cancer staging, you can have a cancer which of course slowly progresses, that stays localized within the kidney, eventually come out and start to go around. How it goes around is that it goes into the blood vessels. You can see from the picture. Now, there are some patients who say that, okay, I'm too elderly and unfit to go for surgery. So can I just treat them conservatively without doing anything? Yes, there are some patients who are actually very unfit to go for surgery, very elderly, and very, very small kidney cancer. In that case, we will say, okay, this belongs to the category of a small renal mass or SRM. You can actually treat them conservatively because you don't really need to do anything. All that we need to do is just to monitor them from time to time. But of course, we still need to monitor them because ultimately, if they grow bigger, then we have to still get a high risk consent for them to go for operation. Now, there are some patients who say that, okay, I have a cancer in the kidney and I really do not want to go for surgery and my cancer is not that big. Is there any other alternative? Yes, cryotherapy also is a form. So you can see from here that the cryotherapy is nothing but ice ball, which is targeted towards the kidney cancer. So it's going to freeze the kidney cancer and ultimately the patient will be symptom free. But he needs to have follow-up. From time to time, we need to get a CT scan done to ensure that there is no recurrence. Now, the best thing, of course, is still surgery because what is the aim of surgery is to achieve cancer clearance, right? So those days, for many, many years, we actually advocated a total nephrectomy. Means if you have a small kidney cancer, we will ask you to take out the whole kidney. But nowadays, we are no longer doing that. When we take out just part of the kidney, those that actually harbors the tumor or the cancer, we only take out that part. All right. So we may just leave behind very, very little, a few millimeter of margin around it and ensure that there is no tumor left behind in the margin. And that is good enough. And of course, for those patients who actually have more advanced cancer, then we can actually advise them either before the surgery go for chemotherapy or after the surgery, we can still advocate them to go for chemotherapy. And of course, we have this targeted therapy nowadays. And sometimes we need this to actually shrink the tumor before it is made, before we subject them to go for surgery. And of course, nowadays, the in thing is immunotherapy. So robotic surgery for kidney cancer, I think, is something that we are all heading towards, especially when it comes to partial kidney removal. Because you know why? Robotic is actually a system whereby it manifests in the form of 3D vision. So we can see the kidney so clearly. It's as if like we are putting our head inside the patient's abdomen. And of course, it's magnified 10 times. So that actually gives us a lot of precision. So when it comes to this partial kidney cancer removal, it's important to achieve a cancer-free margin. And what is better than a robot? I would say that a robot is actually the thing to go. So you can see how we remove the kidney, partial kidney cancer removal. You can see that from the picture here. What we do is that we kind of mark the tumor. So once we marked it, and after that, what we do is that we use intraoperative ultrasound to make sure that we actually get a cancer-free margin. And after that, we will just take out the kidney tumor. So once we take out the kidney tumor, what we need to do is to stitch up the vessels, and actually it's more tedious than removing the whole kidney. To be honest with you, removing the whole kidney takes shorter time than removing part of the kidney because there are a lot of vessels that we have to stitch up. And once we stitch up the vessels, we have to approximate the remaining of the kidney together so that we can actually achieve some hemostasis so that the patient will not bleed. All right. So you can see that the kidney cancer can be actually done this way. So I would say that this is actually the thing to go, and we should be heading towards that. Is there anything that we can do to prevent kidney from, occurring? Well, we don't really know how the kidney cancer coming from, but certain things like, for example, smoking, that is strongly related to kidney cancer, and of course, try to maintain a healthy diet and also exercise. Okay, and of course, if you have high blood pressure, please make sure that you control your blood pressure. I think these are the few advice that we can give, but ultimately, we still do not know how the kidney cancer occurs. So, more important thing is to have vigilant medical checkup. You must understand that kidney cancer is just like bladder cancer. There's no tumor marker. So, for those patients who would like to go to the lab, like for example, BP lab, Ribos, or even the any other labs, for example, to get a blood test done. Well, kidney cancer and bladder cancer unfortunately have no tumor marker. So you wouldn't know whether you have it or not unless you go for a proper screen, for example, an ultrasound or even a CT scan. So I would end my talk here.
All right, thank you, Dr. Warren, for the detailed and interesting slides sharing. Now we will move towards answering some questions from what we have received here. First, we will go for let's see. We have these questions. How common is kidney stones, Dr. Warren?
Well, I say that the kidney stones is actually in this Asian part of the countries, I would say probably about 10 to 20%. Now in Middle East, right, for example, Israel, Iran, they actually have a higher tendency of patient getting stones, for example, up to about 28 to even 30%. Now countries like USA, Europe, maybe about 5 to 10%, so slightly less. So these are the incidence of prevalence of stones.
Okay, okay. I think in this case, in different region, we have different incidences. Next, we have when should you go to the accident and emergency department for kidney stones treatment?
I think most of the patients that come to us via the emergency complain of pain over the loin and going to the groin because you know that your kidney is at the back, your bladder is in front. So when the kidney the stones start to travel from the kidney down to the bladder, obviously it will go through the ureter and the patient will get the loin to groin pain and of course associated with some bloody urine, which may be picked up from a urine test or even the patient themselves will complain that I see frank blood in the urine. Okay, so this is actually one of the common symptoms.
Okay, thank you. Next, we go on. Okay, I think just now you just touched on the same topic as well. What foods and drinks cause kidney stones?
Well, I would say certain things like, for example, red meat, the beef, the lamb, seafood, clams, shellfish, lobsters, prawns, bean stuff, red bean, green bean, black beans, and mushrooms, or even nutty stuff, even tea, for example. So these are the ones that actually stone promoting agent. So be mindful about taking it. I would say that take everything in moderation is the way to go.
Okay, good advice. Thank you. Then we have next questions. What is metabolic workup?
Well, I think metabolic workout basically involves sending the stone for analysis and also the urine and also the blood test for analysis just to find out whether they have some underlying issues. Like, for example, I mentioned to you some condition, for example, cystinuria are basically a metabolic disorder. The calcium phosphate, basically, they have some form of a disorder, for example, the renal tubular acidosis or hypoparathyroidism. So all these things, we have to pick them up from the blood test and urine test, and of course, ultimately the stone analysis as well.
Okay, I hope this answers the question of metabolic workup. Next, we have this is why does passing a kidney stone so painful, doctor?
Well, the reason is because you know that our ureter, so I have a little here. So you can see that this is a kidney and this is a ureter. So imagine the kidney which is formed in the kidney stones which is formed in the kidney is traveling down, being propelled to send down to the ureter and eventually get stuck in the ureter. So obviously the diameter is actually much wider in the upper end. When it comes to the down part, the one that is joining to the bladder is actually very, very narrow. It's very tapering down. So with the stone, that gets stuck here is basically obstructing the urine flow. So any form of an obstruction, patient will present with severe pain.
Okay, now we understand why the painful feeling comes from. Next, what is the best treatment for kidney stone? What is your advice? What is your recommendation?
Well, I think, as I mentioned to you, once a stone former is a lifelong stone former. So you have to watch for your diet. There are things that you can't control. For example, calcium metabolism, you just can't control that. But there are things that you can do for yourself. So avoid certain purine forming, diet. Essentially, it's the red meat, the seafood, the nutty stuff, the chocolate, the tea, the one that I mentioned earlier on. So this is something that you can do for yourself.
Okay, okay. Next we have is it touches on kidney cancer. What are the common symptoms of kidney cancer? I think you just covered. I think you just have
The
to repeat
commonest
again.
symptom is actually no symptoms, unfortunately. Yes, please be vigilant about your medical checkup.
Okay, thank you. Sweet and sharp to the point. Okay, why is surgery an important part in treatment of kidney cancer?
Sorry?
Why is surgery an important part in treatment of kidney
You
cancer?
know, ultimately what you want to do is to achieve a cancer clearance. So I would say that the surgery is important because you want to take out the whole thing and monitor them closely. So if you can kind of like conserve part of the kidney because the tumor is very small, then by all means just take out the tumor with a little bit of a margin around the kidney there. But if you think that the kidney cancer is too big or the tumor is too big, you cannot conserve, then remove the whole kidney. Because ultimately, you do not want the kidney to spread elsewhere, like for example, the lung, the liver, or even the bone.
Okay, okay. I think due to time, okay, we have one last questions concerning kidney cancer. Okay, okay. Is if there is a speck of blood in urine at the end of urine stream, but painless, what does that mean?
Well, painless hematuria or painless bloody urine is actually more dangerous, I would say, because you know why? Most of the time, as I mentioned to you earlier on from the very beginning, bloody urine can be because of cancer, can be because of stone, can be because of infection, the diet that you consume, and also it could also be because of the blood thinner. But ultimately, what is more important is silent killer. Silent killer is kidney cancer. Kidney cancer basically make the patient pass blood in the urine but no pain at all because most of the time the stones, as it get propelled down, get stuck in the tube, as I mentioned earlier on, the patient will have bloody urine together with pain. Well, is the silent killer, like for example, kidney cancers, the one that we need to worry because they most of the time present to us with bloody urine but no pain at all.
Okay, okay. Do we have time for one more to take one more questions? Okay, we will go to the very last question that we have. Apart from surgery, what are the other treatments recommended or available?
For kidney cancer,
Yeah.
it depends on the size of the cancer, right? For very small kidney cancer, confirmed cancer from the biopsy in a very elderly, unfit patient, we would say probably we'll just watch, monitor them actively because this is under the category of small renal mass or SRM, so you may not really need to do anything about it. Now, for those patients who actually have a smaller tumor, want to do something, but again, not very fit to go for it, they have the options of cryotherapy as well, basically, as I showed you earlier on, to freeze the tumor. But that is, of course, not the best thing. Well, ultimately, I would actually advise the patients, if you're fit enough medically, please consider surgery because ultimately you want to take out everything and to achieve a cancer clearance, and you do not want the cancer to go elsewhere.
Okay, thank you, Dr. Warren, for sharing with us for the past 1 hour. Um, we hope, this session brings you a lot of good information. And if you still have any questions, feel free to drop your questions on the chat box. We will get back to you. We will seek Dr. Warren's advice and get back to you and answering your questions here. Meanwhile, we will go offline. You can check back any information, any unique details about the doctors or anything. Feel free to contact us via our website, Facebook, and Instagram. Just give us a call. We will be here to answer you. Okay, thank you for your time. Have a good day. Thank you.
Thank you.